Sir, we are live.
Good afternoon. I think after a 10 days gap, I am back to the air. As you are aware, the entire April month, Indian Rheumatology Association have uh, made us responsible to make public aware about the specialty rheumatology, as well as the rheumatological conditions which are treated and managed by a rheumatologist. See, as you understand, and as quite often people are confused, that treating rheumatoid arthritis is always only the drug. And some medicines, and some even strangely believe that the rheumatologist treats only steroids. But actually, that's not what the facts are. The rheumatologist, no doubt, do use the drugs, medications. If in some emergencies required, may use steroids, not really on a higher or a longer durations. And all rheumatologists as a practice and as a note, he always keeps in mind that to reduce the steroid at the earliest as much as possible and to switch over to other disease modifying anti-rheumatic drug or immune modulator drug as and when it is required. So the basic perception that the rheumatological disease is always managed by just the drug is not always correct. So it is managed by both by medicine, physiotherapy, and all. So to make you are aware that usually a rheumatological treatment or a rheumatologic condition needs a holistic approach, an approach which requires every aspect of the patient suffering from this disease should be taken care. To handle these kind of situations, the rheumatologist is the best leader who can guide you and put you across to the respective subspecialty or sub people who can help you in multiple stages and steps. So what is rheumatology? Rheumatology is a branch of medicine which deals with the diagnosis and treatment of rheumatic diseases, including autoimmune disorders. So it's a branch of medicine that specifically deals with rheumatic diseases. The rheumatic diseases, as you have been told last time, have a lot of conditions, which includes rheumatoid arthritis, reactive arthritis, psoriatic arthritis, reactive arthritis, enteric arthritis, gout, pseudogout, and varieties of other diseases like systemic lupus erythematosus, and some of the non-inflammatory conditions like osteoarthritis, fibromyalgias, traumas, Charcot's joints, etc. So rheumatological disease or disorder is not a single disease. It has a multiple diseases, ranging from a worst aggressive disease like rheumatoid arthritis, where deformities, disabilities occur, a life-threatening disease like systemic lupus erythematosus and vasculitis, simple disease which threatens you but disappears like reactive arthritis, and some of the metabolic conditions like gout and pseudogouts. They are all the conditions which can really cause a concern. These are all the rheumatological conditions or rheumatological disorder which are managed under rheumatology. So when you start treating a rheumatologic conditions, usually what we are looking for is one is the treatment with medicine. And the second one is we will be treating with the exercises. Wherever required, we try to manipulate the diet, especially condition like gout. We are very critical about the diet because diet makes a huge impact on the outcome and the management of gout. When it comes to rheumatoid arthritis, diet may not have a major role. To some extent, modifying the diet, reducing the weight, keeping some of the diets in the right in time in a best manageable diet can help. Stress management becomes one of the very crucial part of the management of rheumatic disease. The reason is the moment we say you have an arthritis, quite a few of you, and including patients, gets afraid, am I going to be disabled down the time? And because pain is so excruciating and causing so much of impairment in day-to-day life, you start feeling that the things are not as good or as going to be better down the time. So that's being the thing. There will always be a confusion about the possible outcome and the possible way things can work out with reference to their patients. So when it comes to the approach, so you have one is the treatment with medicine, and next is treatment with exercise, diet, stress management, as well as the lifestyle. So what is the role of the physiotherapy in a rheumatologic condition? See, as you know, in most of the rheumatologic conditions, you have pain, stiffness, swelling, and if you don't move that joint, the joint becomes stiff. And some of the simple interventions like IFT, heat, cold therapies can bring down the pain and aches. Thereby, it reduces the amount of NSAIDs that you need to take throughout the thing. So it is quite important that the physiotherapy helps in bringing back the patient who is suffering from rheumatoid arthritis or a rheumatological conditions back to near normal shape. So the primary objective which it tries to work on is to bring back the mobility of the joints. I'll dwell into the little bit on that. So what exactly a physiotherapist will do as is first he sees about the medical conditions. He see whether there is anemia or osteoporosis, associated heart disease or any other problems, and looks at the how bad or how good is the disease, and looks also to about whether DMRs, NSAIDs, steroids, how frequently, how you are taking, and pick the joints which are affected. For example, it could be wrist, it could be elbow, it could be knee, or number of joints and how badly affected, and try to assess how good are the strength of the muscles, what is the tone of the muscles, is there any stiffness or strictures in those muscles, and looks at the range of movements possible as well as what we can be achieved with reference to each of these joints. So with a whole intention, the physiotherapy which have both modalities, that is where they use IFT, heat, cold and therapies. In addition to that, a lot of exercises which is going to be done, which is supposed it improves the joint range of motion, reduces stiffness, reduces pain and swelling, and also preserves the joints and improves overall day-to-day disease, what we can say, disease daily living activities. So activities of daily living is significantly improved. Activity of daily living means you are moving from place to place, going for toilet, attending to your regular day-to-day mobility is significantly improved by using physiotherapy as a tool. So in addition to that, with improvement in the pain tolerance with passive and active mobilizations and repeating the movements. So for example, you start moving the fingers up and down and start crimpling the fingers, folding and opening. Using that soft ball, if you start moving those fingers, gradually the mobility of these fingers improves. Even in a normal individuals, if there is a sitting position or a sedentary person, if you are doing that for more than 5-6 years, usually the back muscles, hamstrings goes for a stiffness. If that being the case in a patient who have arthritis, the muscles goes for a stiffness. Good physical activity and exercises improves the range of movement. So also your flexibility and the day-to-day activity will significantly improve. As your mobility and flexibility improves, pain comes down, your speed of achieving some action will improve. Walking to a distance will reduce, and standing for longer time improves. Your skill of movements will improve. So overall, range of motions improves by these methods, which includes a simple exercise by self, by passive exercises with interventions, you can increase your range of motions. So making sure that range of motions is available, you can also use assisted mode like bands, machines, and active exercises that can be done by home using bands, etc. So these things are going to increase the range of mobility. So in addition to that, in physiotherapy as well as exercises, we tend to increase the strength of the muscles. See, the intensity of the load is 30-40% of the capacity, and it should be, you start with a non-weight bearing positions initially, slowly increase the weight from half a kilo. And over a period of time, as you move in the weight, and also as you improve your mobility, the muscle strength improves. One of the common complaint we say, I can't climb the stairs. I cannot suddenly stand up without a huge support. See, more often this is the lack of muscles of the thigh. Strength of the muscles of the thigh is responsible for these kind of lack of activities. So to improve that, if you go with regular exercises, if you do the initially non-weight bearing to gradually weight bearing, these things helps in improving the strength of the muscles. Once you repeatedly keep doing it, you get into a point where you can definitely easily get up from a sitting position, or easily get up from a position of sitting down on the ground, or from the squat. So this is basically where your strength of the muscle matters. So in rheumatoid arthritis or any chronic arthritis, including as simple as an osteoarthritis, usually the muscle strength comes down. There is a study which clearly says 30 to 40% of the pain complained by a patient suffering from osteoarthritis, a degenerative arthritis, is attributable to the quadricep muscles weakness. So weakness in the quadricep muscle, that is nothing but the thigh muscles, can result in a severe pain while you are walking. So that's basically because joint tries to manage with whatever the strength it has. The muscle tries to balance within the strength. That results in the pain signal. So overall, these exercises improve bone density, minimizes the pain, it improves the better coping up and delay in disease progressions. So in addition to that, aerobic exercises increases blood viscosity, supposed to reduce coronary active disease, improves the pulmonary capacity, and also increases exercise tolerance and capacity, but it should be under the guidance of a good physiotherapist. He can gradually increase your cardiac resilience, or what otherwise they call cardio. So if you do these exercises, certainly improves your strength and stamina. Improve in stamina, improves your confidence. Improve in confidence definitely puts you into a better shape. So when you have a joints pain, so you need to work with this balance, respect the pain, balance the activity with the rest. That is, if you have too much of pain, don't overstretch, but we always suggest to stretch by 10-15% of the pain. But you need to work within that. So for example, we have advised to walk for 30 minutes. So what may happen is after walking 10 to 15 minutes, your knee starts paining or your thigh muscle starts hurting. What you got to do is rest for a while, sit somewhere comfortably, enjoy viewing across, and then after 5-10 minutes of rest, your strength and pain reduce, your strength improves, pain reduces, and then walk another 10-15 minutes, take another 10-15 minutes, cumulative 30 minutes initially, which may take 45 minutes to 1 hour, slowly may come back to 30 minutes. So that's how you respect the pain, can stretch by 10-15%, plan your walking or exercise in day, and try to avoid stillness, be on the move, maintain the joint alignment, and maintain your body weight as well as the strength of these muscles. So as I say, it's not just the body strength matters, your mind matters, your confidence matters. And that's where we always say that it needs a complete approach, holistic approach when we start managing the rheumatological conditions. Reduction in stress is which if you can achieve either by meditation or mindfulness or any other methods, if you can achieve a reduction in stress, that is supposed to reduce the inflammation. It is supposed to reduce the aggressiveness of the immune cells. So there is a link between the stressors as well as the persistence of inflammation. However, you need to look balancing between your mind, your body, and as well as how best you can. So try to avoid unnecessary stress. Avoid unnecessary stress. We don't mean that don't get into a work which stresses you. It means that don't take that work as a stress. There's a big difference in these two terms. See, when you walk into any place, if there is some issues happening within your office, sure, you need to step in to resolve it if you are the big boss of that whole office. But you need to balancedly act, see that what's gone wrong, analyze what has gone wrong, take some deep breaths to figure out what is right and what is wrong, and then come into a conclusion how to resolve it. It's a slow, best process to come out of a stress rather than hassling out, ki, ye kya hua, kyun aisa kiya, what are you doing, why are you disturbing? See, these are going to stress yourself and also stress your system. So you need to learn to manage the stress. This can be achieved by a good peaceful mind. Good peaceful mind you can achieve by meditation and having mindfulness and reduce the stress, reduce aggressiveness. What we are trying to say is your approach to a stressful situation should be made. This can be achieved by either meditation, mindfulness, and other activities. Yoga is one of the very important uh, inherited uh, system which is being gifted to all Indians. And this, if you really learn from a therapist who know really about it and can help you to understand and work with these processes, definitely, one, it improves your flexibility, because in yoga, when you use different postures in a more appropriate manner, it almost involves all the muscles, which could be minor to major muscles. That improves the flexibility of the body. And the respiration based exercise like pranayama, brahmi, etc. improves your lung capacity, stamina, and also improves your aerobic resistance. And meditation, which almost becomes a component of it. And in yoga, you're always asked to focus on your respiration, focus on your mind. And when you strengthen and try to integrate them, these three different compartments into your work under your hold, definitely you will improve both in pain management, overall flexibility, your mindfulness, and state of working with the problems and activities. So in addition, you need to be fairly well educated and understand the disease properly. Don't go by what is there in unsolicited advices. Don't go by the advertisements which may not be appropriate or correct. I think most of you may be watching certain things that are happening in Supreme Court with reference to unsolicited advertisements. And also you might have also watched and seen in some of the YouTubes, which we sometimes feel is irrelevant because half of the information are unfiltered or unscrutinized. See, if you come into the medical literatures, most of the medical literature are reviewed, a peer reviews it, sees if there is any issues or anything. They integrate everything and give you a right information. So you need to, as a patient, get an access to the right information, learn the disease manifestation, learn how it can progress if not treated. If treated, how does it also progress? Remission, relapse, how to handle that. Medication, their effect and side effects. See, often we overemphasize on side effect. That's what I was trying to say, getting stressed out. See, when you get stressed out, only bad thing fills up your mind. See, methotrexate, a drug which I use in rheumatoid arthritis, side effect list is there. It's a very big list. It doesn't happen to everyone. The most common side effect, what we talk of vomiting and nausea, it is supposed to happen only 1 out of 10,000. You have a problem like the blood cell count dropping, liver side effect, which happens 1 out of 50,000. So it is not that it is a very common problem. It is a rare problem, but you need to know about it. When you have that problems, it's probably side effect will bring your attention, bring it to your physician or a rheumatologist. He will be able to help you out. So you need to know about that. So you need to learn, understand, see how best it can be managed, see how lifestyles, diet can be managed, how you can manage your mental health and meditations. So regarding diet, few diseases need a modification, few diseases may not. But overall, what we say is use and eat a nutritious food. Adequate protein and adequate energy is required. Protein is required to maintain your muscle strength. And there is a confusion about the protein and purine when it comes to gout. In gout, it's not the protein which you have to avoid, it's the purine which you have to avoid. Urine is totally a different compound from protein. Some patient gets confused. We keep seeing something called C-reactive protein. Is that protein is increased, or should I stop the protein? C-reactive protein is different from the protein what you eat. So don't get mixed up. That's why I'm saying don't go with the sort of a logical thinking, which sometimes may not work. So you need to properly get educated that what diet, how much diet, what's the best diet I should use. If you can manage those diet also will improve overall thing. For example, legumes. If you're a vegetarian, they are rich in your proteins. If you're non-vegetarian, some of the non-vegetarian do have a good amount of proteins. In addition, you can see the difference between polysaturated and unsaturated, which can also help in variation changes with reference to your cholesterol. Most crucial, sleep well. Sometimes the pain can impact your sleep. Try to use a good exercise, stretching, and reduce your stress. That can improve your sleep, and establish a good nighttime routine. Get up and go to sleep at the same time. So try to have a nice, healthy bed with some nice music or something which can soothe you out when you are going to sleep. Shed on all the problems that you have faced throughout your life and on that day. Try to relish the best moments of your life, and then close your eyes. The sleep automatically gets into you. Try to avoid hooking on to some of the drugs which can help you in sleep. So best is to get a nice natural sleep. If you are caffeine addict, avoid caffeine. If you're a smoker, avoid smoking. Just 4 or 5 hours before you go to sleep, because those brain stimulants can keep your brain active and alert. So you need to plan out everything in a nice manner that can help you to have a nice sleep. So nice sleep will also improve your overall stamina and perspective of the life. So in a nutshell, rheumatology practice have a holistic approach. Each rheumatologist in his team will invariably have a physiotherapist, counselor, educator, and a person who can help you in and out. So the best way is to take an appropriate and right treatment with a completeness that improves your overall outcome. Thank you very much for patience.